else who wishes to testify on charge 6? Hearing none, we're going to close public testimony. We are going to move on to charge 9C, Foster Care Redesign, which directs us to monitor the implementation of the initiative to redesign the foster care system. Last session, we passed Senate Bill 218, authorizing the Department of Family and Protective Services to redesign our foster care system with a focus on improving outcomes for foster children. I know the department and several stakeholders have been working on this initiative for several months, and I look forward to our testimony today to hear about the progress we've made and the opportunities that exist moving forward. We have with us again Commissioner Howard Baldwin, our Commissioner of Department of Family and Protective Services. Commissioner, it's all yours.
Thank you, Madam Chair. There is in the presentation, I don't intend to go through each page. I'll probably just hit a few slides as highlights. First of all, just start off with a reminder of some of the background. Clearly, the department and others determined that too often children were placed outside of their home communities, leaving behind family, friends, schools, and all those connections that are really important in their support system. Some of the objectives of Foster Care Redesign are, I'm on slide 3, positive outcomes, promote positive outcomes for children, youth, and families, improve quality and the overall process, align incentives with the process and quality indicators that encourage development of services in locations where they're needed. We have I'm on slide 4, a geographic imbalance in the distribution of services and providers. They're not uniform around the state, and there are insufficient number of residential providers that offer a full continuum of services. And one of the things you see is a number of children who are sent fairly significant distances from their home communities to receive certain types of services. On slide 5, some of the parameters that we start from are the model doesn't require additional funding. We have to do it within available funds. However, it doesn't preclude, and we need to have a model that's flexible enough that if additional funds are added at a later date, we can deal with that. We do anticipate, and we know you did, that the only funding that would be definitely added would be that's needed as caseloads grow, if they grow. And the other prerequisite is that case management functions remain with the department. There have been states who have implemented foster care redesign programs, and generally the states that have had significant challenges are those that outsource not only the care of the children, but of case management. And that is not a mistake that this state is planning to make.
Good.
I'm going to skip a lot about the background, but just to say that slide 6 lists a great deal of public input that was used in developing these recommendations. The actual recommendations started off are found on page 8. They are really 3 major points. We're going to change the way we procure, the way we contract, and the way we pay the contractor. And that's what the goals are, so that we can get better services for families. There's guiding legislation, as this committee is well aware, Senate Bill 218, and then there were riders passed to the Appropriations Act requiring certain reports that we need to provide. The initial approach is to develop 2 catchment areas in which we identify 2 catchment areas or geographic areas in which we make an award. One of those needs to be a metropolitan region and one a non-metropolitan region. We need to have sufficient referrals, new entries into foster care within those geographic areas to be able to have a fair assessment of how well the design works when implemented. And stakeholders and community support should be there, community input that support the implementation of this model. On page 11, we identify the catchment areas that are current. We've issued an RFP after we first issued an RFI and got lots of good comments about it, made adjustments in the RFP, and the RFP was issued, and we identified 2 metro areas, Austin and Central Texas, our Region 7, Corpus Christi, Rio Grande Valley, Laredo, is identified as Region 11 for a metro. And then non-metro catchment areas would be the Lubbock Panhandle area, Region 1, and Regions 2-9, which would encompass Midland, Wichita Falls, are the areas. So potential bidders could bid on those regions, and we did have bids on all of the regions. I'm going to skip over, not going to go into all the detail on implementation, but I'll skip over to slide 15 and just talk briefly about rates. First of all, the department doesn't set rates for foster care. That's set by the Health and Human Service Commission. However, we've come up with a construct that seems agreeable, obviously, to HHSC in setting rates, and there will be a different case rate determined for certain children and youth. So, for example, we know that the services needed for a child who is less than 1 year old when they enter foster care, and older children, say those between 14 and 17, there's going to need to be a different array of services. There are going to be different needs, and obviously the rates will differ. And so you see there listed 4 rate categories, 1 through 4, in which there will be a different rate set. Skipping over to slide 17, where we tell you about the current status. So we received 4 proposals for Region 7, which is the Central Texas region. We received 2 proposals for the Valley, Corpus Christi, Laredo region. We received 2 proposals for both of the non-metro regions, so we were glad we got multiple proposals for each one. Where we are on slide 18, which takes you through the implementation timetable, is that we are now in the stage of holding face-to-face discussions. In some procurements, you hear the term orals. This is much more than orals. There are procurement models that are used by some agencies of the state. I happen to be comfortable with the one that's used by the Attorney General's office, having grown up there, and having, as a private sector person for about 7.5 years, gone through multiple procurements, where you truly engage the teams that bid in a discussion about various issues, the relative merits of their proposal, and any problems you see with that. But you're also really trying to gather information that would inform you whether your construct, your bid, really makes sense in every detail. And what you almost always find is when you get enough bids, you find some things that you didn't think of that other people thought of, and that's what the benefit of discussions is. And so when you engage in that, then you will probably at some point update your RFP as a result of that. You'll do that usually through a best and final offer document. It'd be like a revised RFP, and those bidders who bid will all get a chance to respond to that BAFO, that best and final offer. And in this case, it'll be, I don't know they'll be identical because there are some differences in urban and rural, but you'll basically get those updated responses, and then you'll make a presumptive award, a decision about who you're going. We anticipate giving the tentative contract award notifications, and we're still hedging here, late spring, early summer, but we're still on target for that. I know I told the chair when I met with her not too long ago, I had slowed the process down a little bit, being very cautious, and I wanted to make sure, one, I understood exactly what we were doing, that I felt comfortable that it was the right approach, not in big ticket items, but just that we had it all done. And I made I terrorized the staff a bit when I got there, just because I'm a lawyer, so I'm trained to ask lots of questions, and that's just my nature anyway. And so it was an interesting journey, but I feel very comfortable with the approach we had. I expect that through discussions we will learn things, some things that we might not have identified as issues, and then we'll need to level the playing field by sharing that information through the BAFO response and get better, more honed responses to this. I don't think that will take us longer than early summer. Our timeline is tight, and we will have sometime probably in the month of June a final decision that we're going to make on this. I'll obviously be briefing the Executive Commissioner of Health and Human Services, Commissioner Cease, and then we will obviously be sharing that information with you folks, so you know exactly where we're going and what we're doing.
Commissioner, can we back up for just a second to page
Sure.
10? When we're talking about the catchment areas, you mentioned that a catchment area must have at least 500 new entries of children annually. Can you talk just briefly about what will happen under Foster Care Redesign to the children who are currently receiving services
Yes.
in that catchment area?
Yes. When you make a change in the care needed for that child, so what we're going to hold this old system in effect, and the new system will start up. We're not going to just shift all of those children who are having good results, good outcomes, and everything's fine where they are, and we don't want to disrupt that care. But at some point in the life of that case, if there is a change, they're going to go from a certain level of care they need. Let's give an example. They need to go to a residential treatment center, and they've been in a lower, like a more home-like setting, and they need that because they're having issues that need to be dealt with. Then at that time, we'll move them into the new contract, under the new contract. So if we're going to have to make a move anyway, we move them at that point into the new. Otherwise, as long as children remain in the same level and the same kind of services, they'll stay in that continuum. Now, there is a point in the life of that contract where we get the new system so well established and it's working well and we fine-tune it, that we will eventually have to convert over. So I'm not crazy enough to think that in the period that you have this contract, which is potentially 6 years with all the options, that we wouldn't have converted all of the children in that geographic area within that period of time. And it may come sooner rather than later based on outcome data we're seeing for children in the new model. But it's not our intention to disrupt the placement of children that they're doing well in at the start at all. Okay. So that's a really important question, and I'm sorry I didn't cover it because it is one that's.
Well, let me ask you this. I know that case management is going to remain a role of Department of Family and Protective Services. Can you tell us about how the redesign will impact the role of a CPS caseworker and how we can avoid duplication of efforts between the DFCS and the contractor?
So I don't think it will affect CPS workers much in non-residential placements, and I'm not talking about residential treatment centers.
Right.
I'm talking about kids who are removed from their home and taken into our care. I think that those services that are out in the community will still be there as needed for those children. And so in what we've talked about earlier, family-based safety services, and in conservatorship cases, I don't think the children in those caseloads or the caseworkers will be affected significantly. As foster care redesign goes on, the dollars that we currently control as an agency and contract with providers to provide certain services to families will eventually be integrated into the responsibility that the SSCC single source continuum contractor, the one who's responsible for operation of foster care redesign in a geographic area, have. But that is not initially, and we will have less department employees dealing with those kind of issues. They won't be caseworkers because these are really people who dealt with contractors, right, and coordinate those services. But I don't think from a investigative caseworker there'll be any effect, and I really don't think there'll be much of an effect for the other two groups of caseworkers, except when they're trying to access services, they may go to a different place to call or to contact and not do it with a department employee, but do it with the contractor. So I think it'll be a pretty minimal impact on caseworkers. That's pretty much what I thought in the interest of time I would lay out on this, and I'm happy to.
Okay. Members, any questions? We do have public testimony, so don't close it yet. But any questions, Commissioner? No? Thank you, Commissioner, for your work, and we look forward to updates. We do have public testimony. We're going to open up public testimony. Ask again that everyone please limit your remarks to 3 minutes. There's a buzzer that's going to go off. Ashley Harris, Raymond Kinmen, Mike Foster.
Hopefully you're Ashley.
Yes.
Okay. All right. State your name, who you represent in 3 minutes, please.
Hello, my name is Ashley Harris with Texans Care for Children. As we examine the efforts to monitor the implementation of foster care redesign, we asked the committee review the rollout to ensure the fidelity of the foster care redesign's goals concerning improved system outcomes, specifically the outcome of family reunification, a goal that's supported by CPS and guided by statute. A key feature of foster care redesign is the use of incentive payments. There is concern that the incentive payments could move children more quickly to permanency options such as family reunification or adoption too quickly or prematurely. Indicators should be developed that measure the specific permanency outcomes, including family reunification, to ensure that they're supporting the child's best interest. Through performance-based contracting, specific indicators have been developed that will measure the outcomes and goals of foster care redesign. Family engagement, a key component of securing successful reunification, should be measured and is a meaningful indicator of securing a permanency outcome for children, and it would also strengthen quality service provision indicators. The goals of foster care redesign cannot be achieved without acknowledging and developing specific expectations and measurements related to family reunification. Family reunification is an outcome we all want for Texas children involved in the child welfare system if it's in their best interest. But we have to acknowledge that it's a process that takes careful planning, monitoring, and support, and it can be greatly enhanced through foster care redesign. Thank you.
Thank you. And, sir, you are?
I'm Mike Foster with the World for Children and the Texas Association of Child Placing Agencies.
Please.
TACPA took advantage of the opportunity to comment on foster care redesign during the draft process, and we commented using the online format and by email. Unfortunately, we did not see our suggestions reflected in the final RFP. First of all, TACPA believes foster care redesign is a very important opportunity to work in partnership to significantly improve the child welfare system. As you know, we have had several false starts over the years, and it's important that this initiative be engineered to succeed. We need to make sure that we get this initiative right. TACPA unanimously supports the 8 quality indicators that are indicated by the RFP. But we have pushed hard for many years for those indicators. We have not waited on redesign to implement strategies to keep kids in their home community, to keep families together, to keep siblings together, and to reduce time in the system. We have all been diligently working on those strategies. We think it's important that innovation in performance-based contracting is long overdue. We have asked for that for many years. But it's important that everybody, all the stakeholders, work together to be responsible for those outcomes. We believe that current foster care redesign has some serious flaws that should be addressed before we begin our journey on redesign. I think that we're about to purchase a used car that is continuing to be unreliable and problematic. And that used car does not come with a guarantee or even a warranty. If we don't have the money to buy a new car, let's be smart and do our best to repair the one we have and start saving up for a down payment on a new one that will be reliable, efficient, and make use of the latest technologies and best practices. We're concerned about the administrative costs to fund the SSCC. We'll drain money from direct services. Where is that overhead going to come from? Many agencies and traditional providers, especially mid-size and smaller organizations, worry that it will affect their funding. Foster families are really concerned that it will disrupt their reimbursement. Again, it's been talked about, but I don't think you can call it redesign if we do not address the redundant case management system. That saps a lot of resources. And again, we feel strongly that the SSCC should not be a provider in its own catchment area. That conflict was addressed in Senate Bill 6, and it's emphatic that would be a serious conflict of interest. I'm running out of time, so I'd just like to say that the most expensive treatment is treatment that doesn't work, and we do need to make sure that we get this right. Thank you.
Okay. Thank you, sir. And I guess that you would be Mr. Kinmen.
Yes, sir.
State your name and who you represent.
My name is Raymond Kinmen. I'm the executive director and the founder of the Open Arms Agency based out of Corpus Christi. I'm a licensed therapist and a licensed child placing administrator. I have some serious concerns about the redesign. As Mr. Foster indicated, that there's some issues that are going on that we need to address. I presented you guys with a lot of data in the handout, but I'm going to go over it real quickly in the interest of time. The first issue is the level of bureaucracy, with this being a revenue-neutral program, adding another level of bureaucracy and somebody else that's going to pull funding from the program is just going to take funding from the children and the services that we have. It's not going to offer anything.
You subscribe to the 4 points that he made.
They're very similar. There's one additional one. The second one is that there's a conflict of care by the very fact that the agencies are required to be child placing agencies in the catchment areas. In Senate Bill 6, that was specifically identified as something that would not be allowed. However, in this one it is. The third issue is this, and this is in here. Nebraska tried this almost exact model starting in 2009, and at this point they just released in December the legislative review of the system, and it's in here. And they've come to the point now where they're repealing it. There's a legislative bill 961 that I included, and you can see in there why they're repealing it. And it's based on, it's almost identical issues that we're talking about. There's a conflict of interest. They're losing money. It's costing the state more than they thought it was. And they even went to the extreme to include case management in their system after the initial one because there wasn't enough funding. It wasn't enough to pay for this level of bureaucracy, so they added in the case management, and that still wasn't enough. And so now they have a real big problem in Nebraska, and it's basically the same design. So I think that we need to look at that. You can see in here, I have some solutions to it. I just think that we need to take this opportunity to improve this system without jumping into it. There's some ways that we can fix it, but this has already been tried in other states with mixed at best outcomes. And I think it was a disservice to the kids to just jump into this and hope that just adding another person or another agency that's going to be a bureaucrat in the system is going to change anything. They're not offering any solutions. They're just going to monitor the same thing that's already happening.
Okay.
So.
Thank you. And there's an executive summary in here.
Yes.
Yes.
Included in here you'll see, and I'm sure everybody's familiar with it. Senate Bill 6 is in here. Senate Bill 218, which is driving this, which is the eight indicators. I would encourage y'all to look back at Senate Bill 218 because it just gives you it doesn't give a roadmap. It just gives the ideas that we're working on, and also the Nebraska.
Thank you so much. Thank all three of you.
Appreciate it.
The chair would like to call Nancy Holman, Steve Coble, and Robert Hartman.
Yeah.
Okay, and let's see. You're Nancy, I would guess, so.
Steve Coble.
You're Steve. Is Robert Hartman here?
Oh, he had to leave.
He had?
Yeah.
Okay. Then I'll call Rebecca Allen. Is she here? Please come forward. Okay, Ms. Holman, I'll let you start first. State your name, who you represent, in 3 minutes, please.
Nancy Holman, Director of the Texas Alliance of Child and Family Services, statewide association, and our members are responding to the RFP and will also serve as the subcontractors under redesign. First point I wanted to make is that Foster Care Redesign was put in place specifically to improve the quality of care for kids in CPS custody and to improve permanency outcomes. So it really is a direct response to Charge 6, where you're looking at some of those features, and I think we need to acknowledge that linkage. The second point is that as we monitor the rollout or redesign, there's 4 points I want to make. It was developed through a public-private partnership committee, and that committee does want to stay engaged in monitoring and evaluating the rollout of redesign. So I think it's very critical that we acknowledge their role and keep them engaged in this process. These partnerships have been the cornerstone of successful initiatives in other states. The commissioner brought up the point that there were no new dollars that were going to go into this. However, the rollout was contingent upon maintaining all the existing resources in the system. And we did that last session, but it's important to acknowledge as this rolls out, we cannot take cuts in funding to foster care and expect agencies to absorb these new responsibilities and be successful under the new system. The third point, while case management technically is staying with the state, there is going to eventually evolve into a case rate where you're going to pay people based on the delivery of permanency outcomes. And in the partnership, we talked about how they're going to have to allow providers to work more with families and you're going to have to carefully balance their authority with the outcomes you're asking them to deliver if, in fact, you're going to link payments to that. And this case rate is the third year down the road, but I think as the legislature monitors this, that's something that we need to look at and may have to modify the outcomes if need be if we're finding we can't get that proper balance. My last point was we also are looking for flexibility in the system on the part of the providers, and so DFPS needs to change their oversight to monitoring outcomes rather than just process. And then on my second page, I'm talking about adoption, and but I think that's the permanency goal for 49% of the kids. Funding for private adoptions was really severely cut last session. I think it's very important to take a look at that issue if we want to improve permanency outcome for kids.
Thank you. Okay.
For the record, my name is Steve Coble. I provide Government Relations Counsel to the Texas Coalition of Homes for Children. That coalition is formed of 23 agencies that have provided service to children and families in crisis for approximately 1,500 years. Deeply rooted, good homes in Texas. 2 points to make. Number one, it was heartening to hear Commissioner Baldwin say that he takes a cautious approach, and I also appreciate that he's a lawyer. Nonetheless, we want to be sure moving forward that the coalition members are recognized as a least restrictive resource for placement of children when appropriate. We're not trying to supplant foster homes and understand that there are a lot of service offerings. The concern is that as the single source continuum contract providers move forward, that these homes are not part of the equation. We want to be sure that that available resource is available for them. So for example, if you have siblings aged 12, 13, and 15, the idea is not to separate those children, but to keep them together. Least restrictive is in that family environment, and that's what those siblings know. Secondly, a little bit of concern that perhaps as the contractors move forward, that they notice that some of the coalition members don't accept pay. It's not a cost to the state. So if it's not a cost to the state, the single source continuum contractor may say, I don't want to go there because we, the contractor, are not going to be paid. So it's my understanding that the DFPS staff and Commissioner Baldwin know, or at least have come to the opinion that those contractors will receive funding even though the coalition home will not accept pay. But we want to be sure that at least the contractors are aware and know that they still get their funding. Thank you very much for your time.
Okay. Did you have written materials?
Yes, it's coming around right now. Thank you, sir.
Oh, okay. All right. Okay, Ms. Allen.
Hello, my name is Rebecca Allen, and I serve as the president for the Texas Association of Child Placing Agencies. And I'm representing a group of providers who, within their communities, engage the community members to become foster parents, and they raise funds, and they serve as volunteers for children in care. And our members serve a great number of children who are in DFPS custody. And I, too, would like to publicly express appreciation to Commissioner Baldwin for his caution as we proceed forward, and we want to make sure we do this correctly. TACPA really supports 3 points that I'd just like to briefly cover. One is that we totally support all the goals outlined in the RFP. We want best practice. We want good outcomes for children and families. We believe they're achievable. We also believe that every single provider wants to walk hand in hand with the department to make sure that we're all accountable for those outcomes. So that's one point we'd like to make. The second point we'd like to make is that we believe that the cost of the redesign project could dip into some service delivery funds. Because it is a cost-neutral project, there is some concern expressed that funds that are currently earmarked for services will now go into an additional level of bureaucracy. And so we're real concerned about that. Another point that we would like to make, and this is the one point that we feel we would like to clarify with you the most, and that is that if we're going to implement the foster care redesign, that we give the contract to a person, an entity, that will not provide services as well as be the SSEC. And we noted that in Senate Bill 6, which was sponsored by Senator Nelson in 2005, that the conflict of interest was spelled out very clearly. We would really like to see that implemented in this project as well. And in closing, we ask that you review these comments, remember the lessons from the PACE project in the late 1990s, look at the current issues facing the Nebraska legislature relevant to child welfare, and listen to providers who have developed programs within their agencies to address best practices.
Thank you. Thank you all three, and I listened to you back there while I was back there. Judy Powell. Thank you. Is there anyone else who wishes to testify on this charge?
Does that mean I get more time?
Nope.
Okay, my name is Judy Powell. I'm with Parent Guidance Center, as you know. So I want to ask the question, what will redesign do for the 3 children that were adopted out of the Texas system, recently sent to Ohio, and then found to be prostituted out by the adoptive father? I'm sure a lot of you have read about this case. Yeah. Those 3 children came from Texas. I'm here to tell you that the current way that redesign is being done will not save those children from that fate. Nothing's really changed. I love the comment that Mike said about inheriting a used car. That was perfect. In our opinion, the system hasn't been redesigned at all. It's just a way of paying people to do the same kinds of services, or in many counties, no services, That's the only change, and it has a fancy new name called, performance-based contracting. A legitimate redesign would have included parents, parent advocates, a strong prevention component, as Senator Uresti keeps pointing out. It would have had disproportionality advocates at the table. It did not. We tried to bring that up, and again, they didn't involve those people at the table. It would have involved smaller agencies, not just the larger agencies. You have some smaller agency representatives coming and talking about, their vast wealth of knowledge. They're going to be the people doing the actual services on the ground, and yet you really didn't listen to them. And it would have included an emphasis, like Ashley said, on family reunification, and also weighting adoption and reunification, because still, if we pay for, we get what we pay for. If we pay for adoption, the feds pay for adoption, we're still going to get adoption. So we think that a redesign effort, something that needs to be added that was not even talked about, would be, and this would benefit not just parents and children, but the service providing agencies, is a grievance process. Again, going back to the Bajarona case, we combed through thousands of documents that they released to the public to try to figure out what happened to this little girl and why, and basically it was like having the Capitol here and the exit sign just went out and nobody knows who installed it, 100 years ago. It was a lot of blame shifting, blaming, pointer finger. Well, they had the contract for this. Well, they had the subcontract for this, and they had the subcontract for this. Well, the little girl is dead, okay, and nobody's taking the blame actually for that one. So if we have a strong grievance process built into it, a grievance process for the children, as I talked about earlier, especially those teenagers and stuff that have things happening that can speak up for themselves, have a grievance process told to them immediately. Of course, a grievance process for the parents when things start going wrong. Oh, well, that's not the agency. You're supposed to talk to this person, whatever. Now they're not going to have a centralized caseworker necessarily. And a grievance process for all of the multiple entities who are going to be beholden to the larger entity who holds the purse strings. They need a good grievance process as well. And that's what I have to say about redesign.
Oh, good timing. Thank you. Thank you for coming to testify today. We really do appreciate it. Is there anyone else who wishes to testify on Charge 9C, Foster Care Redesign? If not, we're going to close public testimony on that charge, and Senator Jewell, I think our work for the day is complete. I can't think, Senator Huffman said it so well, I can't think of anything more important that we do as a state than protect our children, our most vulnerable population. So we're going to continue to work through this issue throughout the interim. I believe today was a good start on the discussion. Member, as you know, Dr. Jewell, we've posted our next two hearings for May 8th and 9th to discuss Charge 2, to review the implementation of cost containment strategies across the enterprise, Charge 9A, improving healthcare quality and efficiency, and Charge 8, related to the state's public mental health system. We'll set dates for the remaining charges as we move forward. I don't think we have any other business to come before the committee. Senator Jewell, do you have any other business to come before the committee?
I do not. Thank you, Madam Chair.
Thank you for being here. Appreciate you greatly. Be safe. No other business to come before the committee. We're going to stand recess subject to the call of the chair.